Good morning, good afternoon, good evening, depending on where you're watching me from. So my name is Maxwell Mutambo, aka the Sharp Tutor. So today I want to take you into a very common topic, which is called paracetamol intoxication. So paracetamol intoxication comes as a result of an overdose of paracetamol into the body. So when you take the paracetamol, it has to go to the liver for metabolism by an enzyme called cytochrome P40. So cytochrome P40 plus paracetamol results in an end product which is called N-acetyl P-benzoquinone imine. So this end product, it has a direct toxicity to the cells of the liver, which we call hepatocytes. So when you take the paracetamol, it has to undergo fast metabolism. So the liver will produce an enzyme which is called glutathione. So the glutathione will bind to an end product in order to reduce its harmful effect to the hepatocytes. So now, when someone takes more than 4 grams of paracetamol, the liver will produce more of the glutathione. As the result, the glutathione will be diminished, which will lead to this individual to undergo into intoxication. So when someone is intoxicated, what are the signs and symptoms that you are going to see in this patient or in this individual? So the signs and symptoms has been categorized into what? Into 3 stages. Stage 1, it happens within 1 minute to 30 minutes. So what are these features that we're going to see? So 1, there will be what? There will be GIT symptoms. What are these GIT symptoms? There will be abdominal pain, there will be vomiting, there will be diarrhea. When you check the HB levels, there will be what? There will be low HB. So you are going to find this the patient will be what? Will be pale. There will be cyanosis. Yes. So stage 2 happens within 30 minutes to 24 hours. Sorry, from 24 to 48 hours. So what are these features that are going to see in this patient? Number 1, the GIT symptoms will not be present in stage 2. There will be the peak hepatotoxicity, there will be elevated bilirubin, there will be elevated liver enzymes. When you check the LFT, they will be elevated. So what? Now we move to stage what? The last stage, which is stage 3. Stage 3 now, the GIT symptoms will be present. Remember the GIT symptom that I mentioned, the abdominal pain, diarrhea, vomiting. There will be unstoppable bleeding. Apart from stoppable bleeding, there will be what? There will be elevated liver function, there will be elevated bilirubin. So what do you do when you see those features? So now we go into the management, how you are going to manage this patient who comes intoxicated. First, what you are going to do is you are going to admit them. You are going to admit them. Once you admit them, you're going to now do the investigation that you can do. Remember, we have done some of the investigations. We did the what? We did the liver function test. We did the full blood count where we noted the what? The low HB. So now what other intervention that you are going to do? You have to make sure you check the what? You consider the ABCs. Don't forget the basic principles where you check the airway, the breathing, the circulation. You have to make sure everything is patent. There is patent air. Apart from that, what are you going to do next? You have to make sure that you do what? you cannulate the patient, you give IV access using the 18G, the green cannula, both hands. After you cannulate, you commence the IV fluids. Fluid of choice is Ringer's lactate. Remember, we are worried of what? Of hypovolemic shock. Apart from that, if this patient comes within an hour, you have to do what? You have to do gastric lavage. Apart from that, you can give activated charcoal. Apart from activated charcoal, the important part, you give an antidote, which is called N-acetylcysteine as a bolus at 140 milligrams per kg. Apart from that, remember, this is a patient who comes in hypoglycemia. You have to make sure you give dextrose 10% as a bolus. Apart from that, you do what? You give 70 milligrams every 4 hours of what? Of an antidote, N-acetylcysteine. Remember, do not exceed more than 17 doses of what? Of the antidote. So that is the management that you do. You keep on monitoring the patient. So what are some of the complications that may result in a patient who comes intoxicated? Number one, there can be infections, liver failure, acute kidney injury, thrombocytopenia, DIC, disseminated